How does histopathology diagnose stomach cancer types? Imagine peering into tiny slices of tissue to uncover the secrets of stomach cancer. That's exactly what histopathology does. It's the most reliable way to identify the specific type of stomach cancer a person has. When a doctor suspects stomach cancer, they often perform an endoscopy to look inside the stomach. During this procedure, small tissue samples are taken from suspicious areas. These samples are then sent to a pathology lab for detailed examination. In the lab, the tissue samples are processed by embedding them in wax, slicing them into very thin sections, and staining them with special dyes, most commonly hematoxylin and eosin. These stains highlight the cells and tissue structures, making abnormalities easier to see under a microscope. The pathologist then examines these slides closely, looking for distinctive features that help classify the cancer. The two main types of stomach cancer are intestinal and diffuse. The intestinal type forms gland-like structures that resemble the normal lining of the stomach or intestines. These glands are organized and recognizable, often indicating a progression from precancerous changes like intestinal metaplasia, which is linked to chronic inflammation from infections such as Helicobacter pylori. This type tends to grow in a more structured pattern. Diffuse stomach cancer, however, behaves quite differently. It does not form glands. Instead, the cancer cells are scattered throughout the stomach wall, infiltrating it individually or in small groups. These cells often look like signet ring cells, which have a large vacuole pushing the nucleus to the side. This pattern makes the cancer more aggressive and less associated with chronic inflammation. The diffuse type tends to spread quickly and can be harder to detect early. Beyond just identifying the type, histopathology helps determine how abnormal the cells are, which is called grading. It also assesses how deeply the cancer has invaded the stomach wall, whether it has spread to nearby lymph nodes, and if it has entered blood vessels or lymphatic channels. These details are crucial for staging the cancer and planning treatment. Advances in technology, such as computer-aided diagnosis and artificial intelligence, are now helping pathologists analyze tissue images more accurately. These tools can detect subtle features that might be missed by the human, improving diagnosis consistency. In summary, histopathology is essential for diagnosing stomach cancer types. It involves examining stained tissue slices under a microscope to distinguish gland-forming intestinal cancer from the scattered, infiltrative diffuse cancer. This detailed microscopic analysis guides doctors in understanding the cancer's nature and planning the best treatment approach. Always remember, if you have concerns about stomach health, consult a healthcare professional for personalized advice.